My name is Florin Lazarescu and I'm the president of European Society of Cosmetic Dentistry. I have graduated in 1999, so I'm working since then in dentistry. I'm running this TRIDENT Dental Clinic in Bucharest, and I'm also organizer of events in Romania and in whole Europe with the European Society of Cosmetic Dentistry. I'm also part of General Dental Council, so I'm allowed to work in UK. Since we founded the clinic, we experienced a lot of patients who are coming from abroad, and I will notify here these three types of patients. So first of all, there are Romanians which are not living anymore in Bucharest in our case, and they are living in other countries. And while they are coming for holidays, they want some dental treatments. Second of all, there are patients, expats, which are living for a certain period of time in Romania, in Bucharest. And I mean here employee of the embassies or other foreign workers. And they are looking for dental treatments while they are in Romania. And third category, it's dental tourism itself. So patients which are coming from abroad, especially for dental treatments, and they combine with dental tourism. So we had all these categories in our clinic since more than 15 years ago. I think first of all they have to search for specialists in each domain, because in dentistry it's like a big box, but you have a lot of specialties. You have implant specialists, you have perio specialties, you have endodontic specialties. So first of all I would choose a clinic which has all these specialties, and not only 1, 2 or 3 doctors which are doing the whole stuff. Because if you go to a doctor which is doing only one thing, for sure you'll have the best treatment, because he's trained to perform only these activities. Second of all, I would think also to have a dental laboratory inside the clinic. Why? Because when you are coming from abroad, you want a very good treatment, you want the best treatment, but you want also a fast treatment. Fast, if you have the laboratory inside the clinic, doesn't mean that you won't have quality, but because you have priority to other dental works, you can have also speed, and also you can have the quality. Then, if you have an international team of doctors, for sure you'll benefit of something else. Imagine that the work is done and then you go back home, and maybe sometimes you have a small problem or a minor problem, you need some adjustment back home and not coming here. I would say that this is a very important thing, like a guarantee that your problems will be solved as an emergency back home. And also in my position as a chief of European Society of Cosmetic Dentistry, we have in almost each country of Europe, we have our study clubs, we have our country chairpersons, and we have a very well established networking among Europe. So you can be sure that your problems will be solved not only in our clinic, but also in your house, in your city. First of all, it's the skills that these patients are benefiting from. We have a very good specialist team here. We have a lot of specialties. We have 3 surgeons. We have 2 operatory rooms, like in a hospital. We have the possibility of the patient is staying overnight. We have the general anesthesia, also like in a hospital. We have a team of 3 perio specialists. We have a team of 4 endodontic specialties. We have a CAD/CAM. This technology, it's a new one where you scan the teeth and then you mill some ceramic restorations, and it's done here in our clinic. We have the dental laboratory, so we have the infrastructure to perform all the paraclinic or clinic investigations, and then to perform the treatments. So this is the most important. Then, of course, there are other things like this guarantee of the work that we are doing for 2 years. So anything that's happening in the first 2 years after the dental work, it's covered by our clinic. That doesn't mean that the work will last only 2 years. It's like when you are buying a car, you have a guarantee, for example, for 2 years, but the car is going for, I don't know, 10, 20, or sometimes for your whole life. But in the first 2 years, everything is free, like you need only a checkup. Then while you are coming in Bucharest, we have our clinic car, so we can help you with transport from and to the airport, or to the hotel that we are staying. We have 3 hotels in a 5 minutes walk range, from 3 to 5 stars. Our clinic is located in one of the most beautiful areas of Bucharest, in the Cotroceni area. It's the place where the presidential palace is. So it's a very, very nice environment. We are next to a very nice tennis court, the National Bank tennis court, where all the official tournaments are. So it's a really peaceful, nice, quiet area. If you want to stay in our clinic, we have the possibility to accommodate the patients here. We have 2 special designed like small apartments for our patients, and we can offer them for free from a certain amount of money spent with our clinic. So you have a lot of benefits, and we can explain you all in details when we are going to make the treatment planning. When you take the decision to go abroad for a dental treatment, for sure you are looking for very complex treatments. You don't go only for a decay or maybe one crown, because it doesn't make any sense from economic point of view. So I would say that complex cases like full mouth rehabilitations or implant cases are among the most desired treatments and performed treatments in our clinic for foreign patients. These implants, total mouth rehabilitation, it's a special category, and for this we developed, and we are the only clinic in Bucharest which has an operatory block with 2 dental chairs, also with general anesthesia, with a special environment. All the air which is coming in, it's filtered, and we have a supra pressure of the air from inside and the outside. So it's a special surgery block that you'll find only in high-level hospitals. So security is the first thing that we are looking for. So we designed and we developed these surgery units special for this kind of treatments. Then the sterilization room, it's also very special. We have a certificate from Melag, it's a German company that we are top providers of sterilization here in Romania, because we have a whole line and we can track the sterilization by each individual patient. We are scanning the barcodes for each instrument used to every patient. In every moment we can prove that the sterilization was done accordingly to the highest parameters. Now coming back to the implants, there are some type of implants that are put immediately after extractions, and also you make the temporaries in the same session, because in some cases you might need full mouth rehabilitation, and it's an aesthetic problem and also a functional problem to make the extractions and then to wait and then to come again and to perform the implant, then to go again and then to come for temporaries. So in some situations, or where the bone condition permits it, of course, and we are checking the stability of the implants, we can perform 3-in-1, like extraction, immediate implant, and immediate loading, so immediate temporary restoration on the implant. So the patient is coming in the morning and is leaving in the evening with a new smile, a very functional and a very aesthetic smile. Of course, you have to come back for the permanent restoration, but this is only a normal stuff, and after a couple of months you have the permanent restoration in place. Statistically, the implant success rate is over 99%, So only in a very few cases you can have a reject of the implant. And this is done by either by general conditions or by local topical conditions. If you filter very well the patients and you inform them, like general conditions, we know that the diabetes, for example, you can have a higher rate of non-integration. Or if you have periodontal problems, also you have higher rate of non-integration. Local, almost all the time is done by problems with the blood, which is coming towards the implant, or a very, very tough bone. We have a team of surgeons here which are performing all these implant cases. So it's more than implantologists. There are oromaxillofacial surgeons which are very well trained in what they are doing. So in our case, I would say that this 99% of success rate, it's even higher. We have very, very few cases of reject. And even if you cannot control the reaction of the body, and if the body is rejecting the implant, in our case we are covering this risk for you. And the first 2 years after placing an implant, if the body is rejecting it, it's going to be replaced for free. So we cannot, and nobody can guarantee you 100% success rate. It would be a lie, because we are living bodies and we really cannot control this. But in our case, if it's going to happen something, and it's a very, very low probability, we are going to replace it without any costs. Sure, I would advise you to study and to choose carefully the place that you are going. First of all, the idea that the cost of the treatment will be much lower than in your country. Of course, when you are going to compare the costs between different offices, different countries, different cities, it can vary. But the general idea is that the cost will be lower. Don't go for the lowest price, because usually you'll have also a low quality. Search for a clinic which is among the top clinics in that country. Look on the specialists' bios, CVs, and see what they are good in, see how they are performing, check the feedback from other patients, because now with the online environment you can really search for anything. Some of them they are going to international congresses, some of them they are recognized by the not only national but the international dental community. So you can now know that they are reliable persons, reliable doctors, and they can offer you not only a temporary satisfaction of the work, but also they can guarantee you a high success after treatment work. Also, this after treatment satisfaction and this guarantee that your problems will be solved not in that particular dental clinic, but also in your home, in your city, in your country, it's an important thing to take in consideration. And with our networking of doctors in Europe, through the European Society of Cosmetic Dentistry, we are able to provide you these satisfactions, which sometimes can save you some costs, but also some time, because maybe not necessarily all the time you are able to travel in Europe.